occupational health and safety management system, internal audits and corrective action, planning and conducting COVID-19 program audits. And my name is Kevin Lehner. I'm a U.S. expert with ISO 45001. I'm the president of ECSI Corrective. Here's my email address. That's a picture of me. Talk a little bit about the management system continual improvement process. Plan, do, check, act. Vic Toy did a really good presentation back at the end of March about how to use management systems to help with response to the COVID-19 pandemic, and had a lot of really good stuff to say in that. We're going to talk a little bit about parts of it, but expand on some of the things that he touched on but didn't get into detail on. So, for those of you who are not familiar with Plan, Do, Check, Act by now, let me just give you a little bit of review. It's called the Deming cycle. And with management systems, particularly ISO management systems, you start by planning, figuring out what you're going to do. And with health and safety management systems, it's really about risks and opportunities and figuring out what risks you want to address, how you're going to address them with operational controls, so that they are controlled to what's called an acceptable level. And this will become more important to us later on when we're thinking about, hey, how do we plan an audit? Where do we get what's called audit criteria from? And that's kind of developed in the planning process of the PDCA cycle, okay? And then once you get that figured out, once you get the plan part done, then you actually go about the business of doing that. You've created operational controls, work instructions, you're training people, you're keeping training records, you're really doing the implementation part of the management system. And Vic went into really good detail on that and how to use that during the pandemic and as we begin to emerge from it. Today I'm going to talk a little bit in more detail about the checking part of the management system process, PDCA process. And this is where we kind of, you've implemented the things you wanted to do based on the plan, and now you're going to check to see that what you did is effective, that it actually is implemented, that what should be is, and that what should not be is not. So that's the check part of the PDCA model, and then we'll talk a little bit about the act part of the model. So my focus today is going to be on these two primary areas. We'll talk a little bit about plan and do, but it's mostly about the act or the check and act parts of this. Now this is what's called a bow tie risk analysis, and it's used to for COVID-19, and it's not, the bow tie itself isn't really a risk analysis method. It's more a method for graphically representing the results of a risk analysis. On the left-hand side of this, you have these things called hazards or causes. And with regard to COVID-19, it's sort of like proximity to others who may have the virus, the actual presence of the virus itself, the media by which it travels, airborne or on surfaces. So these are some hazards that may create the exposure to COVID-19 that could result in infection, and that exposure then could result in these effects, reputation damage, legal liability, financial impacts, interested party dissatisfaction, employee dissatisfaction, or even the process disruption. So you've got these hazards on this side. Here is the event, the exposure event, and here are the consequences. Now these actions right here on this part of the bow tie are what we can do to try to address or put controls in place to address the risk to a quote-unquote acceptable level. So with regard to proximity, maybe we'll put some barriers up between workers so that, if they sneeze or cough, it doesn't directly go into somebody else's work area. That's a barrier that could prevent exposure. The virus presence itself, through some testing or tracing, airborne, maybe use PPE, respiratory protection, masks, have a better HVAC system. On surfaces, maybe we clean them. Maybe we do training of employees on how to properly decontaminate themselves, with hand washing and other disinfectants. So these things right here are the controls that can hopefully really address the risk of these hazards and minimize the likelihood that this exposure is going to occur. Now, sometimes it's going to occur, and then on the other side of this, you have some other controls in place. For instance, if the exposure does occur and you want to control damage to the reputation, maybe you got a public relations program going on, posting notices, posting to Facebook pages, web pages, that type of thing. Legal liability if exposure does occur. Maybe keeping records of the things that you did to try to prevent exposure would help you with legal liability. So you have these controls on both sides of the potential event. Now, later on, these are going to become what we call criteria. This is what we want to check to see that's working in the internal audits for COVID-19 exposure. Okay, so let's talk a little bit about auditing, just high-level kind of stuff. Talk about auditing requirements and guidance. Now, ISO 45001:2018 is a very good model of an occupational health and safety management system. And in clause 9.2 of 45001 are the requirements for performing internal audits. And what those say is that you need to conduct internal audits at planned intervals, right? And you need to plan, establish, implement, and maintain audit programs. So we've got to periodically do audits, but we also need this program that talks about who's going to do audits, when are they going to do them, what competencies are they going to possess, how are they going to get done, how are the results going to be reported, those kinds of things. So clause 9.2 provides some requirements and a good model for management system internal audits. Also, we have clause 10.2 in 45001 that talks about incident, nonconformity, and corrective action. These are closely linked. We do audits, we make findings, we have to fix them, or we increase risk to the organization. So this is another important clause. Basically, it says you need to implement and maintain a process to determine and manage incidents and nonconformities. So again, these are requirements of 45001. They're good models for internal audit and corrective action program. Another good resource is something called ISO 19011:2018, and these are guidelines for auditing management systems. They talk about things like how do you set up that audit program that's required up here in 9.2, and then how do you go about the business of determining auditor competence? How do you organize audits? How do you do audits? What do team leaders need to do? So that's a good resource also for guidance on audits. Let's go down a little bit further here and start talking about planning audits, planning a COVID-19 audit. Okay, so the first thing you want to do is think about, hey, why are we doing this? What's the objective of the audit? What do we want to accomplish? And that might be that, hey, we want to check to see if we're complying with the law. That might be one of the objectives. Or the objective might be, hey, we want to check to see that we're doing what we're supposed to be doing in terms of our own internal processes. Or maybe corporate called us and said, hey, we're going to be sending in a team to do some audits because we want to check to see that you guys are doing the right thing. So establishing the objective of the audit up front is very important. Next thing you need to do is talk about the scope, or define the scope. What are we going to be auditing? Are we auditing one department? Are we auditing an entire facility? Are we auditing several facilities? And are we auditing those facilities for legal compliance, in other words, compliance with the law? Or are we just going to be auditing the operational controls that we've established for ourselves? That's how you want to define the scope when you're planning the audit. Once you got the scope, you can start thinking about the criteria of the audit. And you'll remember back to where I was showing that bow tie risk analysis, kind of visual aid, that figure. Well, the controls that we had established really are going to form the basis for the criteria of the audit. And then we start picking out which ones we want to look at. Do we want to look at employee training? Do we want to look at respiratory protection? And the criteria that you're ultimately going to want to audit to should be selected based on risk. In other words, we want to really focus more on the higher risk, more important criteria than the less important criteria. In this case, maybe we want to look at the PPE program. Are people fit tested? Do they have the right masks? Do they know how to wear them? As opposed to whether or not the documentation has got all the I's dotted and T's crossed and is under document control, So and that's something called materiality. It's about like what really matters. What do we want to focus our attention on? So risks have to be considered when you're deciding what you're going to be auditing, but it also helps you apply what's called a sampling approach, where, if we tried to audit everything that we could possibly audit everywhere, we would never complete the audit. So we have to use a sampling approach. And based on that, the results of that sampling approach, we can have confidence in the results of the audit and the conclusion of the audit, which we can talk about a little bit later. But establishing the criteria is really important. What is it that we want to prove true? What do we want to show is, and what do we want to show is not? Another thing in the planning is the method that you're going to use for auditing. Are we going to do this visually? Are we going to have people on site, actually in the trenches, boots on the ground, interviewing people, taking notes, taking pictures? That's the method. And then also the schedule. What's the schedule going to be? And what are the times going to be? What are the durations going to be in the different areas? And you want to pretty clearly pull this together, document it, and then also communicate the method and the schedule to the auditee so they're aware of when you're going to be there or when the audit is going to occur, and what sort of information is going to be looked for during the audit. Okay. Another important part of planning has to do with auditor competence. You want the people doing these audits to be familiar with the principles of auditing. You want them to be able to understand how to ask a good question, how to follow an audit trail, to be able to understand the relationship between, audit criteria, audit evidence, audit findings, and audit conclusions. Okay, so that's an important area of competence. How do you do audits? How do you report them? How do you write good findings? Auditors need to be competent in those skills. They also need to be impartial. You don't want to be auditing your own work. And here's an example. Maybe the auditor competence the auditor is going to need to be competent in respiratory protection. Okay, they're going to be going in and doing an audit of the respiratory protection program to prevent COVID-19 spread. And they have to understand that, they have to know about different levels of protection and what face masks work, under what conditions, how they need to be maintained. And unfortunately, in a lot of organizations, really the only person that has a really good handle on that might be the same person within the organization that's responsible for actually implementing those programs, right? It's a health and safety manager who knows everything about the respiratory protection program, and nobody else in the organization really knows about it. The quality manager doesn't really know about it. The the environmental manager doesn't know about it. So, if the health and safety person were to be auditing the respiratory protection, it would be difficult for them to be impartial. There would be a threat to impartiality there, what's called a conflict of interest. So got to think carefully about who is actually going to be auditing. Okay. You also, during the planning process, want to think about reporting results. How are we going to report the results? When are we going to report them? Who are we going to report the results of the audits to? And you also want to think carefully about if what you're going to do if during the audit you make some critical findings. Here's an example. You're into the audit. You're about 3 or 4 hours into the audit, and it becomes just readily apparent that the organization has not really done much of anything to try to prevent exposure. No respiratory protection plans. Really, nothing is in place. And this is a critical finding, and people are at risk. The question is how do you treat that finding at that point and alert the right authorities within the organization in a timely fashion so that they can take urgent steps to fix that problem. So that's another thing you want to think about in the planning process. If we discover these things that are really important, who is in a position of authority to hear this, and who do we need to report them to? Okay. Last, and another important thing, not lastly, but confidentiality. When you're planning an audit, you want to think about, hey, how do I need to keep this information confidential, especially if you're doing compliance-related auditing. Who needs to know this information? How do we ensure that it stays with eyes only that need to know it? Sometimes these are done under what's called attorney-client privilege to protect the information from discovery. But it's important to think this through during the planning phase rather than get to the conducting phase and then have to start thinking about it. Also, we want to be thinking about risks to auditors and auditees. Risk to auditors. Okay, we're going in, we're going to do an COVID-19 audit. What kind of PPE do we need if we're going to be physically present on site, interview people, looking at records, looking at processes? Do we need special masks? Do we need fit testing? What kind of gear are we going to have there? Other things. Do we need steel toes, hearing protection, on and on. But then also for these COVID-19 audits, we need to be thinking about, hey, what about the auditee? How do we protect them from the auditors should the auditors unknowingly or unwittingly be infected, not showing any signs, and exposing the employees to COVID-19? So again, another important area to think about during planning. And then at the end of the planning process, you make a determination, hey, is this audit feasible? Can we actually do it? Do we have enough information? Do we have enough criteria? Is the auditee willing and cooperative? And if the answer to all of those questions is yes, and the audit is feasible, then we're going to move on to the conducting phase and conduct the COVID-19 audit. Okay. And there's kind of a sequence that I like to follow in these. I always kind of like to start with an opening meeting where, if it's virtual, you have a lot of people, or as many people as you can get that are interested on the meeting as possible, to explain to them what the schedule is going to be, what's the objective, what's the scope, how the findings are going to be reported, those types of things. Just really get everybody on the same page. And also, if there are any conflicts with the schedule, you can resolve them right then so that there aren't, any unnecessary delays in the process. Then go ahead, after you get the opening meeting done, you start collecting evidence. And this is where, you've identified your criteria. What do you want to prove true? And then you go out and you compare that criteria to the evidence that you see or hear or read, either on the floor or through the line of questioning. And you compare the evidence that you gather with the criteria, and that lets you identify a finding. Okay, and findings can either be positive or negative. Positive findings are great. Usually they're just recorded as notes. Yep, the PPE that is in use meets the requirements. The person has had a fit test and their training, and they've got their respiratory protection. All good. On the other hand, some findings might be negative, where things are not the way they're supposed to be, and typically these get recorded in another fashion so that they can be cascaded into the report in a way that is actionable for the auditee. So, we identify the criteria, we compare it to what we see as evidence, and then we make findings during the audit. And then as the audit is winding down, you can start looking at conclusions by looking at the sum of the findings. And the conclusions might be that, hey, great, the COVID-19 program looks like it's in really good shape. We were able to gather a lot of good evidence of conformity. And, here are a couple minor opportunities for improvement, but generally pretty good. Or the conclusion might be something like, there's some pretty significant findings here that need to be urgently addressed, and the system isn't really that effective. So that's kind of those are some conclusions that you might draw from the audit process. And then this is the kind of information that you would disclose during a closing meeting where you kind of review, hey, how did the audit go? Were people cooperative? Were there any obstacles? What was the good stuff in the audit? What are some of the negative findings? What are the next steps? And all of that gets discussed, hopefully with the same group that you had during the opening meeting to kind of debrief on the audit. And then you go about the business of preparing and distributing the audit report. And, this can vary. If corporate if it's simply an internal audit, then you want to distribute the audit, maybe pretty broadly to the people that need to know. But if it's something that's under attorney-client privilege, you may have to limit the distribution of that audit report to only a very few people within the organization. And in some cases, maybe corporate counsel is conducting the audit, and they say, hey, we're going to send our folk in, they're going to do the audit. We're not going to report the findings to you. We're going to report it to the board of directors. So you're not going to know what happens. That's kind of an unusual situation, but it is altogether possible. Okay. And then lastly, there's audit follow-up with corrective action. And it's really important to do the audit follow-up on the findings. And we'll talk about that part of the audit now. We're moving into the kind of the act part of the plan, do, check, act cycle. So let's talk a little bit about risks and from actually doing audits. And you can actually create more risk for the organization through the audit process if you do not have a good, effective corrective action process. Why is that? Well, during audits, you can have a great audit, make a lot of good findings that need to be fixed, but if you do not address them effectively in a corrective action process, that is sort of that smoking gun of knowing and willful, who knew what, when, and what did they do about it. So it is really critically important that if you're going to do audits, that you have a good corrective action process, okay? And there's something that I call a corrective action workflow that helps organizations define a process. And in my experience, a lot of organizations that struggle with the corrective action process do for two reasons. One, they don't have a good workflow. They haven't described who does what, when, where, why, and how. Okay? Just haven't thought that through and haven't documented it, and they haven't communicated it to everybody. Okay? So workflow is one thing. The second reason that they sort of fail is because they don't have a good way of tracking it. They don't, they make the findings, they create the corrective actions, but then they sort of get distributed and people don't act on them in a timely fashion, and some of them fall between the chairs. So you need a good corrective action workflow. And this is a graphic that sort of shows you a little bit about what that workflow might be, the corrective action workflow, where you start with an audit finding, then it's assigned for investigation in stage 2 for investigate the cause and the corrective action. And here we have a gate. These are called approval gates, and this is an important part of a corrective action workflow. You want to have an approval process here so that when a cause is proposed and a corrective action is proposed, a team can review it and approve it before it actually gets implemented. Okay, the collaborative approach to these corrective actions is really pretty important. So once it's approved, once the corrective action is approved, it can go on to stage 3, where someone actually performs the corrective action. And then after that, it can go on to the stage 4, where somebody else needs to come behind and verify that the corrective action was implemented and that it is effective, all right? And then there's the second gate, approval gate. Once it's been verified, then and only then can the team lift this approval gate, and it can go on to the closed stage 5. So that's just a kind of an example of a workflow that should be followed when you're addressing findings from audits, including COVID-19 audits. Okay. Also, I mentioned that tracking and closure of the corrective actions is sometimes a problem. Some organizations just have paper documents that they use to track corrective actions. They have what they call CPAR forms or corrective action forms, and they print these out and they handwrite them, and they put them in somebody's in basket, and then that person's got to fill them out and return them. They don't have any sort of stage gates or approval gates in the process, and often these paper-based systems or electronic document-based systems, things fall between the chairs. There's no way to know what status that corrective action is in, or at least it's difficult to figure it out. And often these lead to a situation where someone will be assigned a corrective action, and yeah, they'll go ahead and they'll kind of, excuse the expression, pencil whip a cause analysis, and they'll put a quick fix sort of correction in there, implement that, and then just they have the authority to close it, and they just close it themselves, and the problem really never gets solved. All right, it just is not, at least not solved in a way that's going to prevent it from recurring. Okay, so it's important to have a good system to track these, and there's some new applications that are currently being developed and available to help organizations do this, that are worth taking a look at. Now, once all of the corrective action stuff is done, you have to bounce this off management review and let management know that the corrective actions are being taken care of, or if there are problematic corrective actions that aren't getting fixed, that management needs to intervene to change, to make it better, all right, to help and to get those corrective actions fixed in a way that won't happen again. Okay, so that's kind of what I had. Here's my email address. We've also got a couple of websites. CorrectTrack, it's a website that shows an app that we've used with our clients for over a decade to help them keep track of nonconformities from new finding through closures, and we're now making it available to others who might be interested in a good methodology for tracking and closure of corrective actions. And also, we got another website, Environmental Compliance Systems Inc., encompsys.com, where we've got some information about some of the training that we're offering. We have a couple of exemplar global certified lead auditor courses, one for occupational health and safety management system, ISO 45001, and one for ISO 14001 environmental management systems, coming up in June, July, and August. So that's it. With that, if there's any questions, be happy to take them. Stop that. There we go. Are you still with me?
I am. That was great.
Think so?
I do.
Cool. Cool.
Yeah,